Hey everyone, welcome back. It's Dr. Jennifer, and let me ask you something before we even get started. Have you ever climbed a single flight of stairs and felt like your legs were filing a formal complaint against you? Or maybe you stood up after sitting for a while and your legs felt shaky, achy, or just plain tired, even though you didn't run a marathon? If you nodded yes to either of those, stay right here, because today's video might genuinely change the way your legs feel for the rest of your life. I'm a doctor, and over the years, I have had hundreds of patients walk into my clinic complaining about leg cramps at night, weak knees, restless legs, swelling, or that strange heaviness that creeps in after a long day. And 9 times out of 10, when we run the blood work, we find the same hidden culprit. Not a lack of exercise, not aging, not bad luck, a vitamin deficiency that almost nobody talks about on social media. Today, I'm going to break down 3 specific vitamins that are absolutely essential for strong, pain-free, powerful legs. I'll explain exactly what they do inside your muscles, your nerves, and your bones, and I'll give you real-world catchy examples so you actually remember this instead of forgetting it 5 minutes after the video ends. By the end of this video, you will know exactly what to ask for at the pharmacy, what foods to eat, and how to protect your legs for decades to come. So grab a notebook, get comfortable, and let's dive straight into it because your legs literally carry you through life, and it's time we start treating them that way. Let's start with the first vitamin, and this one might surprise you. Vitamin D. Now, I know what you're thinking. Isn't vitamin D just for bones? That's the old way of thinking about it. Yes, vitamin D helps your body absorb calcium so your bones stay dense and strong, but here's what most people don't realize. Vitamin D also talks directly to your muscle fibers. Think of vitamin D like the electricity company for your leg muscles. Without enough of it, the lights are dim, the power is low, and your muscles simply cannot contract the way they're supposed to. I had a patient, a delivery driver in his 40s, who came to me convinced his legs were just getting old. He said climbing into his truck felt like lifting bricks. We checked his vitamin D levels and they were shockingly low, even though he was outside all day. Turns out he always wore long sleeves and sat in his truck with the windows up. Within 8 weeks of proper supplementation, he told me it felt like someone swapped his old legs for a new pair. Here's a catchy way to remember it. Think of vitamin D as sunshine in a capsule. Your legs are like solar-powered machines, and without enough sunlight or supplementation, especially in the colder months or if you work indoors, your muscle engine simply runs out of fuel. Symptoms of low vitamin D in the legs include muscle weakness, that heavy feeling when walking upstairs, achy thighs, and in some cases, even an increased risk of falls in older adults because the muscles supporting balance become weaker. Good sources include fatty fish like salmon and mackerel, egg yolks, fortified milk, and of course, sensible sun exposure. But many people, especially those over 40 or those who live in places with long winters, may need a supplement. I always recommend getting your levels checked before just guessing, because too much of anything isn't good either. Now let's move to the second vitamin, and this one is the unsung hero of leg comfort, vitamin B12. If vitamin D is the electricity company, think of vitamin B12 as the wiring system inside your legs. B12 is essential for nerve health, and your legs are absolutely packed with nerves that send signals back and forth between your brain and your muscles. When B12 runs low, those wires start to fray. This is where things get interesting, because B12 deficiency often shows up as tingling, numbness, or that classic pins and needles sensation in the feet and legs. Some patients describe it as walking on a cloud of static electricity, like their legs are slightly out of sync with the rest of their body. Others experience restless legs at night, that uncomfortable urge to move your legs right when you're trying to fall asleep. I remember a school teacher who came to me describing her legs as feeling like they were buzzing all night long, like a phone on vibrate that never stopped. She wasn't sleeping well, she was exhausted, and she assumed it was just stress. Her B12 levels were severely low. After a few months of correcting it through diet and supplementation, the buzzing disappeared completely, and so did her sleepless nights. Here's the catchy memory trick. Think B12 equals B for battery and balance. It powers the communication wires in your legs and helps maintain steady, confident movement. Without it, the signal gets weak, like a phone call dropping in and out. B12 is found in animal products like beef, eggs, dairy, and fish. This is especially important for vegetarians, vegans, and older adults because as we age, our stomachs naturally absorb less B12 from food, even if we're eating enough of it. If you've been feeling that strange tingling, numbness, or restless sensation in your legs, this is one of the very first things I check in my clinic. Now, let's talk about the third vitamin, and this one is often overlooked vitamin K2. This is the one almost nobody mentions, yet it might be the most important for long term leg strength and circulation. Vitamin K2 plays a critical role in directing calcium to where it actually belongs your bones, instead of where it doesn't belong, your blood vessels and arteries. When K2 is low, calcium can end up depositing in the walls of your leg arteries instead of strengthening your bones. This can contribute to stiffness, poor circulation, and that achy, tired feeling in your calves, especially when walking longer distances. Picture your leg arteries like garden hoses. When they're flexible and clear, water, or in this case blood, flows smoothly and powerfully. But when calcium builds up in the wrong places, it's like the hose becomes stiff and clogged with mineral deposits, restricting that healthy flow. Over time, this can lead to that heavy, crampy feeling, particularly in the calves, sometimes known as claudication, especially during physical activity. I had a retired postal worker who walked for decades without issue, but in his 60s started complaining about cramping in his calves every time he walked just a few blocks. We addressed his vitamin K2 levels alongside his overall vascular health, and along with proper guidance from his cardiologist, his circulation improved significantly over time. Here's your catchy phrase to remember K2. Think of it as the traffic director for calcium. It tells calcium exactly where to go into your bones to build strength and away from your arteries to keep blood flowing freely through your legs. Vitamin K2 is found in fermented foods like natto, as well as certain cheeses, egg yolks, and grass-fed dairy products. It's not as commonly discussed as vitamin D or B12, but in my clinical experience, it deserves far more attention, especially for anyone concerned about long-term leg health and circulation as they age. So let's quickly recap what we covered today. Vitamin D is your muscle's power source, keeping your leg muscles strong and ready for action. Vitamin B12 is the wiring system, keeping nerve signals sharp, steady, and free from that tingling, buzzing, restless feeling. And vitamin K2 is the traffic director, making sure calcium strengthens your bones instead of clogging your arteries, keeping circulation smooth and your legs feeling light instead of heavy. Now, here's the most important thing I want you to take away from this video. Vitamins are powerful, but they are not magic pills, and they are not a replacement for a proper diagnosis. If you are experiencing persistent leg pain, numbness, swelling, or weakness, please don't just self-diagnose based on a video, even mine. Go see your doctor, ask for proper blood work, and find out exactly what your body needs. Supplementing blindly without knowing your levels can sometimes do more harm than good, especially with fat-soluble vitamins like D and K2, which can build up in the body over time. What you can do right now, today, is take a look at your diet. Are you getting enough sunlight or fatty fish for vitamin D? Are you eating enough animal products or considering a supplement for B12, especially if you're vegetarian or over 50? And are you including some fermented or fortified foods to support your vitamin K2 levels for healthy circulation? Small, consistent changes truly do add up. Your legs carry you through every walk with your family, every flight of stairs, every morning jog, and every single step of your daily life. They deserve to be strong, steady, and pain-free. And sometimes that starts with something as simple as what's on your plate or what's missing from it. If this video helped you understand your body a little better today, do me a huge favor and hit that like button. It genuinely helps this information reach more people who might be struggling silently with the exact same symptoms we talked about today. Subscribe to the channel if you want more honest, doctor-backed health content without the fear-mongering or the gimmicks, just real medical insight explained in a way that actually makes sense. And drop a comment below telling me, have you ever experienced tingling, cramping, or restless legs? I personally read through as many comments as I can, and your story might just help someone else feel less alone in theirs. Remember, your legs are not just there to get you from point A to point B. They are a reflection of your overall health, your strength, and your vitality. Taking care of them starts with small, informed choices, and I'm so glad you spent these few minutes learning how to do exactly that. This is Dr. Jennifer reminding you to take care of your body, listen to what it's telling you, and never underestimate the power of the right nutrients at the right time. I'll see you in the next video. Until then, take care of those legs because they've got a long way to carry you. Stay strong, stay healthy, and I'll catch you next time.